Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne. Each week, we bring you board-certified veterinary guidance to help your flock thrive. Let's head to the coop. Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne, and today we are in Wimberley, Texas. Beautiful Wimberley. We've had so much rain and everything is green and gorgeous. And we're at Katie's home. And we're going to look at Dog today. So Dog's having a little bout of peritonitis, we think. And we're going to first talk about that. Katie, why don't you give us a few details about what's going on with Dog and what she's kind of experiencing and how this has come on over the last couple days?
Sure. About 6 days ago, looking back, because I didn't realize it at first, but she just started eating less and being not herself, not full energy, kind of laying down a little bit more. And then I found her in the coop, going to bed a little bit early. And then I found her in the laying box in the evening, but she didn't lay an egg. And so I knew something was up. And then as time has progressed, she's eating less and less. So she's barely eating anything right now. Feels a little bit firm in her little bottom, her abdomen. And so I don't know. I don't think it's sour crop, but we'll see what's going on.
Yeah. So one of the things when Katie and I were talking, she mentioned sour crop, and you notice basically, which is GI stasis is kind of what we call that, right? So there's something going on, systemic most likely, and the GI tract or gastrointestinal tract digestive system kind of stops or slows down at least, and which slows down what's emptying out of the crop. And the crop doesn't have any sort of digestive capacity, really. There's an enzyme or two that are in there that help break down starch, but for the most part, the pH is good in terms of growing bacteria and yeast and other things. Mm-hmm. And there's really no digestion that goes on, which makes a great environment for yeast to grow. So we can see sour crop or an overgrowth of yeast in the crop, just because essentially a sac that's wet and moist and essentially stable, right, sitting there. Mm-hmm. And so without things continuously passing through and into the lower GI tract, things can start to ferment and we can see yeast overgrowth. So it's usually secondary to something else, and that's most likely what's going on here. And we think, it's hard to know with certainty, and we'll try to talk about some of the ways we can determine if it is peritonitis or not. And often we'll say egg yolk peritonitis, and we'll talk about that in a second. That's one of the things that slow down that GI tract and can cause that potential sour crop type issues. Okay, so we mentioned egg yolk peritonitis. I want to talk a little bit about what that is and how it comes about. So if we think about the reproductive tract, so starting from the ova and what's called the infundibulum, or the catcher's mitt, if you've ever heard about it. When that ova falls or drops from the ovary, it catches that, and then that's the very beginning of the egg production, right? That's where fertilization actually happens, and that same part is all true in a lot of species, including us. But as that ova progresses, the white's added, and the shell starts to add, and then 24 hours later, it's coming out the back end. But what that means is that's an open tube. So that reproductive tract in a hen is open into the abdomen, catching that ova as it falls, all the way to the cloaca, which is where the GI tract empties, it's where the urinary tract empties, and then obviously the reproductive tract empties out. So what that means is there's bacteria there at the end, and sometimes those bacteria can make their way up, go retrograde up that reproductive tract. That's what we would call salpingitis, or a bacterial infection of the reproductive tract. And if it progresses far enough, it can make it to the end of that opening of the tube, the infundibulum, and actually infect the abdomen. At that point, we call it peritonitis. And if you have bacteria present, and let's say one of those egg yolks or the ova does not fall into that catcher's mitt, it can actually go into the peritoneum or in the abdominal cavity, and you combine that with bacteria, and then you've got a bacterial or septic peritonitis is a better way to put it. That is not good, and what happens there is you get a really quick, usually very rapid infection, and birds tend to wall things off, and so they don't succumb very quickly, but relatively quickly they can succumb to it just because that infection gets overwhelming. And if you think about egg yolk, it's a great media to grow pretty much anything, right? It's full of nutrients, it's fat, there's all kinds of good things in there if you're a bacteria. And it grows really quickly and very fast. So the best thing we can do is, Katie had noticed that Dog was not feeling very well, and so reached out, and while I would say the prognosis is still guarded, she's doing well and she hasn't lost a lot of weight yet, which were all good things. she's not super lethargic, so she's got energy there, and it's always better to start these treatments early and get in front of it rather than waiting till the last minute and really when it gets even, the prognosis is even worse.
Right.
So that is Yolk Peritonitis. Any questions there?
I don't think so. I guess I've heard like people can maybe drain the fluid and then like after that give them antibiotics. Like what's the process?
Yeah. Katie mentioned the fluid in the abdomen. That's 100% true. It can be there or it can't, right? And so early on, less likely. As it progresses, just the inflammation and reaction to that infection in the abdomen, we do get more fluid produced. The fluid's always going to be yellow in this case, so like straw colored. The worse that infection becomes, it turns cloudy, like opaque, and that's essentially bacteria in there, yolk material in there, just infectious process type material in there. So when we drain it, which we'll potentially attempt here in a little bit, just the color of the fluid can be an indicator of how bad it is, right? Sometimes there's even blood in there. Obviously, the more cloudy, the more angry looking that fluid is. Blood in it would be a good example of angry. The worse the prognosis would be. So yeah, we can drain the fluid. If it's clear fluid, that's a good indicator of cystic right oviduct, and we've talked about that in the past with videos. If it's the yellow tinged fluid, and let's say she's not feeling super lethargic, that could be a sign of peritonitis or like a liver issue that's affecting, causing basically like fluid buildup in the abdomen, which is basically serum. So it's the liquid portion of the blood in the abdomen. Can you hold her?
Yeah.
If that's all right.
You have to ask her. You're okay.
Do you mind? Okay. Okay. Let's see. She does feel like she's got something in there. And it's large. It's probably multiple eggs, or it's a very large, potentially tumor. Because it is longer, and it's definitely not one egg.
Yeah, she laid her last egg probably 5 or 6 days ago.
I would say it's probably almost like the size of 3 eggs. But yeah, that firmness you feel is that mass.
And we don't know unless, what would like an x-ray show it?
Yeah,
or?
a radiograph would tell you would see like the shell's really easy to see. So that would tell you, is she egg bound or is it a mass? And if it's an egg, or multiple eggs, then that's potentially get those out and things go better. If it's a mass, then probably not. And she's still in good shape. I mean, you're right. She's not. She hadn't lost a lot of muscling.
Yeah, she was pretty healthy. I mean, once I realized what was going on, but like looking back, it was pretty abrupt. It was like, I mean, as we know, they hide things, but it was like healthy, 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 laying, boom, not laying, and just
slow decline.
declining.
If it's a mass, it's probably like Marek's or lymphoma related, so I mean, it's cancer. Usually if it's like a mass like cancer like that, it's progressive and it's like just draining, so like it depletes them, and she doesn't really have that about her. So
Right. I did try to put some like calcium, some Tums in when I gave her some antifungal when I thought it was sauerkraut, but not a lot. I didn't soak her in Epsom salt. I knew that one.
So calcium, 100%, it's like critical for muscle, actually relaxation, right? So without calcium, that's why people go into rigor. Or not people, but any animal, when it dies, the energy in the cell is depleted, and so the cells actually have to pump out calcium in order to relax. And so when they run out of energy, the calcium comes into the cell and it just contracts, right? So with that low of calcium, where you can't just say, oh, well, now the reproductive tract is going to work. It's like the heart's going to go first, right? So low calcium is like super critical. And if actually they pull it out of their bones, chickens do probably a better job of any other species because they're mobilizing calcium every day in and out. So yes, calcium tetany can happen, but we usually see it as like sudden death with an egg in the tract. Like when we do necropsies, you find perfectly healthy chicken with a full egg in the reproductive tract. And it's usually at night or early in the morning when it happens, because it's just real sudden. And you find them before. Sometimes you can save them with like calcium gluconate. I don't know if you ever worked with cattle at all, but so dairy cows, like milk fever, same thing. They're making all this milk and they can't mobilize calcium fast enough, and the calcium will get low enough where they actually start to shake. And chickens will do the same thing because those muscles, they're not functioning like they should, or the cells aren't functioning like they should, and yeah, they'll eventually succumb to low calcium. So yeah, I'm thinking more of the egg binding. Although the only reason I'm not like 100% is because one, it's large, and two, I can't feel like it's solid. It's like I'd say it's probably about that big, whatever it is. And so it's not uncommon, like you'll have an egg in there and then potentially a second egg, or chickens also, when we talk about walling things off, it happens really quickly actually. And so they'll just wall this stuff off, and it doesn't take long, and you've got a pretty good sized mass. That's the other thing too, it's large, so actually getting it out, the natural way will be tough. But
Yeah.
at least we can see, like, kind of potentially see where it's at.
Okay.
Ideally, it would be best if we could get this out kind of the natural way. The second option would be to surgically remove it. Obviously, that's not ideal either. Hopefully, he's going to be a good patient, and we're going to take our time. But what I'm going to do is try to digitally put my finger in the cloaca, and then I'm going to feel there's a sphincter where her reproductive tract is, like the opening to the reproductive tract, and maybe be able to get a finger in there and see if I can't get a finger on the actual mass or egg, whatever happens to be. That's where it helps to have smaller fingers. So it's fairly easy to get your finger in the colon essentially, but the thing is you've got to find the opening of the reproductive tract. So again, there's like 3 openings there. You won't feel the urinary tract. There is a sphincter for the reproductive tract that you can feel, smaller opening. And again, there's like preventative mechanisms, right? That sphincter prevents things from getting up there. So like what we do in cattle is essentially feel through the large intestine to feel, like for a calf, if we were palpating a cow to see where that calf was at or how far she was in gestation, you're feeling through the intestinal wall to feel that calf. In this case, it's kind of the same. Ideally, we'd try to get a finger in there in that reproductive tract and see if we can't manipulate it out. In her case, I'm having trouble.
Do you feel it at all?
I can feel the top of it, yes. What I'm almost trying to feel now is if there's other masses in there. In her case, I can feel now like multiple nodules, which would be, I can't say for certain, but my fear would be that it's like lymphoma essentially, like potentially cancer, as opposed to just one mass that would be the egg. So I'm not gonna give her any more. Not a good prognosis. It would be it's, again, I'm like weighing what it could and could not be. So there are some other nodules in there, like I mentioned. It's actually really large and it's central. It would be a large mass if it was, like, be one of the largest that I've seen. Not to say that they can't get big. I've definitely seen some big ones. So lymphoma or tumors like that in a hen, you're pretty much certain it's Marek's. It's just one of there's not many things that cause that in a chicken. They don't randomly get cancer. They don't live that long. It's usually virally induced. So, yeah, I wish I could give you better news.
Yeah.
And I still can't say for certain, right? I mean, if you're willing to make the investment and for peace of mind, I would say if it's an option, a radiograph would tell you a lot. One, it would tell you if there's an egg in there versus just a large mass of tissue. And if it's a large mass of tissue, then you're like, okay, well, it's just more likely lymphoma associated with Marek's disease, or she's egg bound and there's other little things in there too, or potentially both. I mean, all 3 could be an option. So, again, apologies. I know that this isn't good news. I know.
I know. I promised you I wasn't going to cry.
More than welcome to. Yeah, it sucks with all the issues and reproductive issues in hens are are one of the things that we have to deal with and owners have to deal with.
Well, we're gonna give her the best life she can.
Yeah.
We can,
Yeah.
you know, and she's had a very spoiled, good life, and we'll figure out what we're gonna do. But
Well, she's in good hands. I know you've taken great care of her, and 4 years old, so she's been around for a while, and
yeah,
they get very close.
yeah, we love her. She's a good girl.
So not all cases end well, I would say, and in this particular case with dog, we thought it was an infection, and then obviously as I palpated the abdomen, what we thought was potentially peritonitis was more likely that she was egg-bound, and of significant egg binding at that. Now, we're not just talking about one egg where she was trying to lay for a day or two. It something that came on relatively quickly by the time Katie found out about it, or at least was able to notice. And so, again, the prognosis is not great, but she's going to live out her days here, and you're going to take great care of her like you have for the past 4 years, and let her be the wonderful chicken that she was. But
Yes.
and I think this is a great example. We can't fix them all, and you know, there are times where you need to make a decision, you know, from the point of the welfare of the hen, you know, what's best. And she's not suffering. She's I would say comfortable. She's still pecking around. She's well fleshed, so she's eating a little bit. And yeah, when the time is right, you'll make that decision. And until then, dog will continue on. But I really do appreciate you sharing your story.
Thanks.
And I'm sorry to deliver bad news, but you know,
That's
sometimes
okay.
it happens. So
Knowing makes it better. You know, it's better than just kind of stewing in your mind, going crazy, wondering if you can do something or not, and feeling powerless. So that we have a direction to go with, and we know what's going on. Now we can make decisions and just take care of her. And I always have this mantra. It's like, I do my best and I surrender the rest. You know, that's all we can do is just love them and take good care of them. So thank you.
you're welcome, and thank you for sharing again. And yeah, I couldn't have said it better. So again, we're leaving this one on a little sad note, but again, at least you're in a comfortable spot, and you kind of have expectations that we're trying to deliver those too. So thanks everyone for joining, and follow us and click the likes and subscribe, and we'll see you next time. This is Dr. Blayne with the Poultry Dog Podcast.